Hello, everyone, and welcome back to the DRH Show. I'm thrilled to have with me today a true pioneer in the field of humanistic psychology. He has been at the forefront of the existential therapy movement for over 30 years as a clinician, author, and educator. He is past editor of the Journal of Humanistic Psychology and president of the Existential-Humanistic Institute. Through his many books, he has explored the depth and contradictions of human nature with sensitivity and wisdom. His insights reveal new pathways to finding meaning and embracing the fullness of our humanity. And most recently, he has authored a new book called Life Enhancing Anxiety Key to a Sane World. We'll talk more about that. Dr. Kirk Schneider, thank you so much for joining me today.
Well, thank you so much, Dennis, for inviting me.
Well, Dr. Schneider, I understand you're a leading figure in existential humanistic psychology. So, how did you first get interested in this field? So, just give us a snapshot of your background, your trajectory in life, and how you ended up doing what you're doing.
Well, if you have 5 hours, I could just begin to tell you, Dennis, but it's quite a long story. I'll try to make it as short and concise as possible. I was really introduced to this field at a very young age in a kind of a metaphorical sense, following the death of my 7-year-old brother when I was just under 3 years old. And this was a 10-month long process where several diseases finally attacked his heart and he succumbed to, I believe it was pneumonia. As you can imagine, this was a shattering, both for me and my parents, and was really a ripping open of the safe and familiar experiences that I had up until that time. And so it was like an explosion of fear and the unknown, being thrust into the unknown. And I was very terrified of death, of illness. I had a lot of fantasies about monsters and witches, and just fear of life itself, and even some fear of my parents, my mother in particular. I couldn't understand the connections between them and his death. And so just very, very filled with panic and anxiety and rage too. But fortunately, my parents were very psychologically minded, and my mother actually worked with a psychoanalyst herself to cope with the great tragedy at this point. And this was very unusual for our community. Grew up in a working class, middle class neighborhood, and I don't think anybody saw an analyst. So my mother was quite pioneering in her way. In any case, she had her analyst refer a child analyst to me because I was having increasing difficulty coping up to about 6 years old. And so at that point, I did see this psychoanalyst, and it was one of the two most important therapeutic contacts of my life. Probably helped to save my life in many ways. And basically what this analyst provided was a place where I could begin to move from a place of abject terror and paralysis in my situation to gradual curiosity and wonder about the situation I was in, increasing understanding of what had happened, and that it wasn't my fault, it wasn't my parents' fault. uh, and a kind of contact with bigger questions about living that very few young children, especially, begin to deal with, like, what is this life about? What is death about? And eventually questions about how to live one's life, given that one is facing death, and and how to make the best of one's life. And so I began to become increasingly interested in creativity, made up my own plays, and began to write eventually as I became older in school, write creatively, short stories. Was very interested in actually in science fiction and horror, which makes a lot of sense to me in retrospect, because those are areas that explore the tragic, the shadow sides of living, but at this, and which I related to a lot, but at the same time open us up to the possibilities for wonder and discovery in those realms. And eventually this led me to an interest in becoming a writer, in philosophy, writing, thinking about philosophy, and a growing interest in psychology. And I had a great teacher of introductory psychology my first year of college, who made psychology relevant to my life, our lives, society. And it just, right at that point, I decided that was the direction I was going to take, becoming a psychologist, put together the writing, the philosophy, and my fascination with human experience and behavior, certainly including my own. But I was still very much on the journey when I hit graduate school, and I was very far from home in a small town. I was in a great department, a humanistic psychology department, but it was also very challenging for me because it did stretch me in so many ways. And for a number of reasons, some unfinished work from my childhood began to break through. And it was partly triggered by a very revered professor of mine who gently challenged me to work at a local mental asylum in the town. And that just opened up a lot of primal fears for me that I hadn't completely dealt with as a child. And it led me to probably the most important therapeutic contact of my life, a 9-month-long engagement with an existential therapist, Ann Guston, who taught me, I think, probably the most important psychological lesson that one can learn, especially if one is capable of working at that level, and that is to be as fully present and to stay with the most difficult, the most painful places that one experiences. And that's what she modeled as a person as well, and being able to hold my upheaval, my torments. And that's what she taught me to practice in the most, at the most anxious times, the most panicky times. And I was in quite bad shape, even though I was in graduate school. I was really struggling with, I would say, even my stability, my sanity. I had a kind of nervous breakdown at the time. But as I say, that was the greatest gift that I could have, and it's lasted me for 40 some years. And that is to be able to be present to these areas in myself that were formerly blocked off. Literally a reoccupation project, as I call it, reoccupying the parts that were too scary to enter into, almost like your eyes adjusting to a dark basement. She helped me gradually and at my own pace to adjust to that darkness, that free fall that I was in, a sense of groundlessness and helplessness. That's how I'd call it. So that I could live a freer and more responsive life. And, it was no panacea, but as I say, it's really enabled me to go on to be, to actually, achieve my doctorate. I eventually actually worked at a state hospital with some of the most severe clientele around, and worked in all kinds of extreme situations. I think largely because this therapy enabled me to have a foundation of presence, where I just developed a much greater inner freedom to be connected to thoughts, feelings, body sensations, imaginings than I ever could have had if I didn't have this work in my life. So that's a start.
Mhm. Well, that's a very personal journey that led you to your chosen field. But building on that, Dr. Schneider, could you outline the core principles or philosophies that form the bedrock of humanistic psychology? I believe you already touched upon it with your, when you explained to me your background, what led you to this field. But do you believe that this field of psychology diverges from or kind of complements to other approaches like CBT or psychoanalysis in addressing human condition?
Well, I believe that existential psychology is impacting the larger field of psychology more and more now, as people realize that going deeper into one's struggle and being able to explore that struggle and, as I say, literally and figuratively reoccupy the core wounds that had been crippling one in the past is so vital for a more choiceful and enduring vitality in living. And also, I myself have developed and identify with what I call an existential integrative approach to therapy, which is one way of understanding and coordinating a variety of therapeutic approaches, bona fide approaches, within an overall existential or experiential context. And by experiential, I mean the emphasis on the immediate, the affective or emotional, the kinesthetic or embodied absorption of the struggle, and the profound or cosmic, spiritual dimensions of the struggle. And I believe strongly in making that dimension available, that experiential level of contact available, both within the client and between client and therapist, can be so valuable for so many people. And I think the field is increasingly recognizing that. However, in our standardized training and in most graduate schools, the faculty tend to be CBT, cognitive behavioral oriented and neuropsychologically oriented. And so I think, unfortunately, we're going in two different directions, becoming more medicalized as a field, but also recognizing increasingly the importance of the depth dimension or experiential dimension. And I think this is part of our struggle today. It also has to do with the whole socioeconomic model under which we live, which is oriented around, speed, instant results, and the appearance and packaging of things as distinct from the inner life of people. Quick fix, instant result. And I'm not saying that the more programmatic approaches like cognitive behavioral medical are not extremely valuable to people at various times in various contexts. They are. And I certainly refer people for work in those areas. But I think for many people, being exposed to practitioners who also have this greater capacity to support presence or the holding and illuminating of that which is palpably significant within the client and between client and therapist is just imperative for those people to live fuller, more meaningful, and what I would call more awe-based lives. By awe, I mean having a sense of humility and wonder, or a sense of adventure toward living as a whole, not only just accomplishing specific goals, although those could be really important, whether they're creative projects or deeper relationships. But having a whole new attitude toward living from that inner freedom, that capacity to range within the good, the bad, and the ugly, to be able to be with one's vulnerability, but also one's boldness and creativity and capacity to take risks. It's one of the greatest gifts that one can have. So to give you a thumbnail definition of existential humanistic therapy, or existential integrative therapy even, it revolves around two basic questions. How are you presently living? So it opens up that exploration. And that may reveal that one is living in such a way that one needs medication at that point, or just needs some supportive intervention to get through the night. But that's a very important question. These are questions that are both implicit and explicit throughout the entire existential humanistic integrated process. So how is one presently living? And on the heels of that question, how is one willing to live, to take responsibility for how one is presently living, or ability to respond to it? And we try to co-create an atmosphere where people feel safe enough to explore those questions as fully and as deeply as possible. But what's really important here from an existential integrative standpoint is the client's desire and capacity for deeper change. And not everybody has the desire or capacity to be fully present in the ways I was describing earlier. And so that's okay. I think we need to respect that. And sometimes that is a stepping stone or a foothold toward a deeper, more experiential level of contact. And for those who are able to work at that deeper level, the therapists, call greater attention to not just the words that they are saying, but how they are saying those words. So the process, what is happening in their body, their facial expressions, their vocal fluctuations, how they hold themselves as they're describing their struggle. All these for us are gateways to deeper contacts with one's core wounds, basically with one's primal terror of the unknown, which can then open one up to elements of curiosity and wonder and even discovery about the unknown. Again, like the eyes adjusting to the dark basement.
Now, given these profound elements that you just discussed, Dr. Schneider, I think we can also talk about Existential-Humanistic Institute. I mentioned this in the beginning that you founded this organization. So would you like to explore more about its missions and how do they advance the field?
Yes, well, I co-founded the Existential-Humanistic Institute back in 1997. And it was really a legacy from our mentor, James Bugental, who was one of the founders of Existential-Humanistic Psychology, along with Rollo May, both dear mentors of mine, where he was really pressing a number of us younger practitioners to actually have a home, a place for other practitioners to specialize in existential humanistic practice, because there were so few institutes in this area. And we realized that if we're going to have this perspective endure, we're going to need to, foster more trainees and have a concerted program of courses in the approach, without hopefully losing the humanity of the approach. And that's what we've attempted to do, to strike that balance at EHI. We have a couple of certificate programs, one in the foundations of existential humanistic practice. And what's involved in that is, first of all, a didactic component where students need to take several courses on existential humanistic and existential integrative therapy. And then they need to be involved in a series of video consults in regard to patients they're seeing and how they're applying the principles to their work with patients. And they're also very much invited to workshops that we put on periodically throughout the year. We just had a wonderful workshop on the legacy of Otto Rank, an existential psychoanalyst, arguably the originator of existential humanistic psychology way back at the birth of psychoanalysis. And finally, it culminates in a approximately 6-day retreat in wine country here in Northern California at a ranch, where students are gathered in a very concerted way that really enables folks to connect with each other and with nature at this more experiential level. And that's what we're really trying to cultivate in that setting in particular, is helping people with that dimension that they rarely get a chance to practice so concertedly in their day-to-day lives, and in more standardized training, which doesn't really particularly focus on specifically cultivating presence. Again, that holding and illuminating of that which is palpably significant within the person and between the person and his or her partner or therapist. And so we do that through promoting role plays and very live work, students working with live issues with each other in demonstrations, but also in role plays, pairings, following demonstrations. and a variety of exercises we use, such as the silent dyads exercise, which can be a very powerful way to learn presence, where you have one person role play the therapist, the other the client, and they sit with each other for about 3 minutes, attempting to embody as best they can, without saying a word to each other, the role of therapist and the role of client. And then a processing, a quite intensive processing of what came up for them after those 3 minutes of engaging with each other in that way. And it's really remarkable to hear the kinds of insights that the therapist had of the client and the client had of the therapist, and especially, again, this sort of pre-verbal kinesthetic aspect of what was going on, which is often described through metaphor, feeling like a tightness in one's chest, or not feeling grounded as they were sitting with this person, or what have you. But there can be some, very rich observations from exercises like that, and other kinds of exercises that are related to our immediate aliveness and struggle with feeling alive and feeling freer to make choices in our lives.
Now, I just want to explore more about your perspective, because in your book you've kind of explained anxiety as potentially life enhancing, which is quite a paradigm shift. So, could you explain how this reframing can benefit individuals?
Well, I see life enhancing anxiety really as the core of the healing process in existential humanistic and existential integrative therapy. It's really all about that. First of all, I define anxiety as the fear or terror of the unknown. And I believe with Otto Rank, in his book Trauma of Birth and subsequent writings, that this really is the foundation of virtually all our future anxiety and trauma. It is the echo or the background for all future anxiety and trauma. In that the point at which we're thrown into this life, the point at which we move from a place of relative non-being and unity to sudden abrupt being and pandemonium, is the sort of template for the sense of groundlessness and helplessness that we so often feel when we're anxious, when we feel abandoned, when we feel rejected, devalued, lost, ill, perhaps. Groundlessness and helplessness, floundering, a kind of free fall, which, it seems naturally connected to that crucible of birth. However, I don't call it just the trauma of birth, I call it the drama of birth, because I think there are elements of wonder and discovery early on too, or just on the heels of the shock and overwhelm at the beginning. And this is what we want to foster more for our therapy clients as well, is to help them move gradually and at their own pace from a place of terror and overwhelm with the unknown, especially that primal sense of the unknown, if people can go into those deeper places that echo the birth process, to gradual curiosity about their situation, wonder, to taking risks with feeling the upheaval of the groundlessness and helplessness with their therapist in their lives, and expressing feelings of terror, of sorrow, of smallness, of anger, and thereby gradually coming into larger and larger places of living. I'd call it coming into, again, more of the place of wonder and discovery that is the other side of that groundlessness and helplessness. In other words, one's world is ripped open with the groundlessness and helplessness, but at the same time as it's, chaotic and terrifying, it's also potentially liberating and enriching, right? Because there's no rules, regulations at that point. The whole issue is, can one develop the skills and equipment to work with one's anxiety, that primal anxiety? And that's what I mean by life-enhancing anxiety. Life-enhancing anxiety is the capacity to live with and make the best of the depth and mystery of existence. That's the basic definition. Or put maybe more concretely, it's the capacity to live on the edge of wonder and discovery, not only terror and overwhelm. And this is what we attempt to help people do as they proceed through the existential, humanistic, and integrative therapy process, so that they can come into more fully their whole body experience of living, not just from an intellectualization of life, or through changing thoughts or changing behaviors, or being changed by some outside element such as medication. Again, all of which can be helpful at different points for different people. But at these deepest levels, to find one's own sense of agency about what deeply matters and being able to come into that and live that. And often, as a culminating aspect of that process, not only can people then break through to projects or relationships that they've deeply wanted and that deeply mattered, but again, that whole new attitude toward living that I call awe-based, a sense of humility, because one can be with one's smallness before the vastness of creation, and wonder, curiosity, capacity to participate in something much greater than oneself, a kind of spiritual dimension, at one and the same time. That one has a capacity to shift back and forth between those modes.
Exactly. Let's just delve more into the impact of your work, because I understand that your work has crossed many borders because it's been translated. So what kind of reception has existential humanistic psychology had internationally, and how does its impact differ across cultures?
Well, I can tell you that I've been to China 4 or 5 times, been to Eastern Europe, Russia, and most recently Lithuania, about 5 times for workshops. These are all workshops, talks, Japan, and many other countries, Argentina, France, the UK, etc. Also, existential psychology has become more and more prominent on the world scene through these world congresses of existential therapy. First one was in London in 2015, and then 4 years later it was in Argentina. And then 4 years later, just recently in May, it was in Athens, Greece. Another place that has profoundly embraced us. And I think we're having a growing international receptivity to the field, and certainly, it began in many ways in Central Europe um, with philosophers like Nietzsche and Kierkegaard, and eventually Heidegger and a number of the existential theological folks like Paul Tillich, Martin Buber, Gabriel Marcel, Abraham Heschel. But all people and philosophies really interested in the big picture, the big questions about living, and especially this realm of the unknown, again, or what Otto Rank calls the irrational. I would call it the non-rational. And others, like the theologian Matthew Fox, calls the mystical, which I'm very much with too. I mean, it's existential philosophy is so much about helping us to face and work with the radically unknown, the radically mysterious, that again we all experience as a part of our human condition, and that some fortunately can tap into and experience a richer and more discovery-based life. And I think it also leads to greater capacity to relate to differences, both within oneself and toward others in the world, and so has an ethical implication as well. And I think people are recognizing that more and more, and I'm certainly advocating that. I've actually been very involved in the last 6-7 years in the bridge building dialogue movement between people of highly contrasting backgrounds, cultural and political. I was a moderator for Braver Angels, which does that work here in America in group settings mainly. And I've developed my own version of it, even well before Braver Angels, called the Experiential Democracy Dialogue, which is a one-on-one format that takes people through 6 phases to help humanize their encounter with each other and their dialogue, as opposed to just seeing each other as stereotypes and labels and reducing each other, demonizing each other, which is usually our fear-based reaction, right? When we feel groundless and helpless, we want to rigidify and absolutize and have an easy, simple way of looking at people and places. So that is work that a number of us have been increasingly involved in. I also have a YouTube channel called Core of Depth Healers that I'm working on with a terrific graduate student named Tyler Gamlin from Saybrook University, which is devoted to giving people video samples of depth-oriented therapists and existentially oriented therapists who are applying the principles of that approach to social crises. So we have displays of Carl Rogers working with very conflicting groups, like in Ireland, one of the examples. Arnie Mindell, who's been doing this kind of work with an approach he calls deep democracy or world work. I have a number of examples of my own work applying experiential democracy dialogue to racism, Donald Trump, and people on conservative liberal sides of issues. And we have other samples of applying this work to gun violence and to cultural and political polarization generally, so that other healers in particular can bring this kind of work to their communities beyond their consulting rooms. And so that's another place where I think the existential integrative work is catching on more and more. And in the United States, Again, a mixed picture. We have increasing videos of existential humanistic therapy and wonderful handbook that's coming out on existential humanistic psychology, being edited by Lewis Hoffman and colleagues uh, through the APA. This is all through the American Psychological Association. Um, we have chapters in major APA handbooks coming out on existential humanistic theory and practice. And actually, I'm involved in a 75 chapter handbook by formerly quite traditional, as I understand it, social psychologists such as Kenneth Vail and Richard Ryan. 75 chapter handbook of the science of humanistic psychology. And I and Lewis Hoffman and Theopia Jackson, another leader in our field, are writing a chapter on existential, humanistic, and integrative therapy for that book. So that's going on, but also about 80% of the faculty in traditional APA-approved graduate programs are cognitive behavioral. Approximately 10% are eclectic, and the last 10% are psychodynamic and existential humanistic. So there you have an idea that we're working in two different directions right now in contemporary American psychology, in my view. And too many people, I think, are emphasizing psychology as a science in a conventional sense. I do think it's a science, but it's a human science. And a human science very much emphasizes the qualitative dimension, the literary and artistic dimension, not just the quantitative experimental dimension, which can be so reductive in both understanding and addressing human suffering, it seems to me.
Absolutely. But so a lot of people might have been inspired by, you giving the core elements of existential humanistic therapy and how we can apply it to, different dimensions of life. But for the next generation of psychologists who are drawn into this field, what guidance would you offer to those just beginning their existential humanistic practice?
Well, I would say if you're interested in the deeper dimensions, and I think more and more people are, in part because we are becoming more of a multicultural field, which I think is a great thing. And that is actually pushing us more toward the phenomenological and the qualitative dimension, because people from different cultures recognize that the American culture or the Western culture does not have the last word on understanding and addressing human suffering. And in fact, unfortunately, is alienating to a number of other cultures or indigenous cultures. And so I think naturally there is a press to look at the world in a more in-depth way, and in a way that comes through the prism of one's own culture, but also that recognizes the primal struggles that we all have, again, around life and death, birth, terror of the unknown, but also wonder and discovery with the unknown. And so I would recommend that people really tap into those treasures from different cultural standpoints and undergo their own depth psychotherapy, for themselves. I think that is crucial for anyone who wants to work more deeply with patients, is to be able to become more present to that which is other and different in oneself, as well as between oneself and the world. And to practice that, not just relegate that to the silo of academia or a training center, but really practice taking time to taking stock of one's life, private, undistracted time through walks in nature or just alone time to be present to what is charged or what is alive in oneself at that moment, and to see if you can stay with that to the point where it becomes almost second nature to feel more embodied, feel more whole as you go through life, and to experience people, places, and things with one's whole body experience to the degree possible, as distinct from just intellect or behavior. And I just say one other thing quickly. I would say, please recognize how important your role as a healer is in today's world, both for individuals and our collective situation. How important it is to support people to work with the unknown and places where they feel groundless and helpless. That's the only way I think we're going to have substantive and sustainable and peaceable lives with each other, where we're not coming from fear-based places, but coming from more love-based and courage-based places.
Well, those are definitely lovely message of encouragement for those wanting to follow your path, Dr. Schneider. But I'd like to wrap this up with some quick fire, light-hearted questions. So I prepared
Okay.
3 questions for you. So the first one is, what were you afraid of as a child?
Well, I pretty much went into that, I think, before.
Oh yeah, but
Death and dying. Death
okay.
and dying. And the complex symbol of death, too. Ernest Becker, one of the great originators also of existential psychology, with his book Denial of Death, talked about not just the physical notion of death, but the complex symbol of death. And that's really what I'm referring to when I talk about that sense of groundlessness and helplessness. It's a place of feeling utterly lost and in a free fall with no one to catch you, and no feeling of support, even though there are people attempting to, but you're in such a spin, a down spiral, that it feels like you're cut from the tether of a mother ship, in a sense, in outer space.
And if you hadn't been a clinician, what would you have pursued in your life?
Great question. I've often thought that I would probably, for sure, I'd pursue creative writing, and that's still something I'd like to get to. I've written a lot in nonfiction, which I love, and I love exploring these themes. But I would love to explore fiction more, get back to that. And maybe a theologian of the Paul Tillich and Matthew Fox orientation, who are concerned with the mystical, the radically unknown, and with the very human challenge of doubting, of being in anxiety, but at the same time saying yes to life and finding a faith, even if it's a faith, as I put it, a faith in the inscrutable. I call myself an enchanted agnostic because I take mystery very seriously, to the point where I have some kind of overarching faith that in the ultimate, it's so much greater than us that I believe there's some kind of consoling element in that.
Mhm.
So yeah, probably theology, creative writing would be 2 areas.
And what is your favorite word in another language?
Ah, Well, I'm not sure of the word now, forgetting the word, but in one of the African tribal traditions, there's a perspective called Ubuntu, Ubuntu, and as I understand it, it means I see you. And it seems that in its fuller expression, it is a profound, uh, a profound illustration of presence to oneself and the other in a greeting, in a simple greeting. And boy, is there anything more that most of us would like than to feel seen and heard.
Yeah, that's lovely African word, Dr. Schneider. And finally, the floor is all yours. What should people take away from today's conversation?
Well, I hope the main point that they take away is how important life-enhancing anxiety is for so many of us, and how it not only can help us individually, but help us uh, collectively, spiritually, and clearly with the wars and violence going on in our world today, the prejudice, the bigotry, political, cultural divisiveness. We have a major groundlessness and helplessness problem. We have a lot of people who feel terribly insignificant, and to compensate for that, they become either extremely avoidant and withdrawn, or destructive and tyrannical, and try to lord themselves over other people just so they can do everything they can to avoid that groundlessness and helplessness. So if there's one message that I'd like to have come through is help your patients, help yourself come to terms the best you can with the radically unknown, with that dark basement, and your eyes slowly adjusting to the light, with developing presence to yourself and to others, and try to bring those capacities out to our communities, to our households, our communities, and even our governments and legislators could use a big dose of being able to encounter each other more again from that courage or love-based point of view, as distinct from fear-based and knee-jerk reactive point of view.
Absolutely. Indeed, in a world rife with division, your approach appears more relevant than ever. Well,
Thank
Dr.
you.
Kirk Schneider, clinician, author, and educator, it's been a pleasure having you here on the DRH show. And I look forward to hearing more about the impactful work you're doing.
Thank you so much, Dennis. I really appreciate your presence to this conversation.
Yeah, thank you.